And thank you, John. Welcome to West Michigan's Morning News. Steve Kelly, Brett Bakita, Rick Albin here, Sam in the producer's booth. We're joined on the live line after that lead-in by Dr. James Pickney II with Diamond Luxury Medical. That's in Dallas, Texas this morning. Dallas County Sheriff's deputy in Frisco said he was feeling ill and had been in the apartment of Thomas Eric Duncan, the man who died Wednesday of Ebola, has been hospitalized. Doctor, I guess our first question for you today is, have you heard any updated information about him? And then secondly, how does visiting the apartment, how do you catch Ebola from that?
Well, the first part of your question, we haven't had any recent updates. Right now, his blood is being sent off to the CDC for testing for Ebola, but the case has not been confirmed. Now, the second part of your question, it's very difficult to catch Ebola just by casual contact in the apartment. He served the warrant to Mr. Duncan's family and then went about his day. So we're just being extremely cautious. The odds of him catching Ebola are extremely low. However, the CDC and the Dallas County Department of Health are doing an excellent job being overcautious and making sure that this case of Ebola does not turn into an outbreak or an epidemic.
I had a conversation with some folks running for office yesterday and asked them both about Ebola, and they kind of said what you did. Well, the risk is relatively low, and, we can kind of hopefully be able to manage this. I got to tell you, as a guy who's not too hysterical about things, I don't like this. I mean, and all of this, well, it won't happen here, doesn't comfort me. Why won't it happen here?
Because of the process that have already been set in motion. In West Africa, they don't have the resources to quarantine, per se, 48 people. The 48 contacts with Mr. Duncan have all been quarantined, are being watched very closely, and that mechanism just doesn't exist in West Africa. So if you can put these protocols into place and be overcautious, you can guarantee that you will not have a huge outbreak. Now, the possibility of a few patients being infected, that is a real possibility. We may see another case in states around the U.S. We've got the case in Spain. I would not be surprised if we have another case of Ebola pop up.
I mean, here's the thing. I know you got something, Brett. I wanted to get to it. But, I mean, no matter how isolated it is, if I fly anywhere, I've got to go through Dallas or Chicago. Those are two airports where they're going to start taking people's temperature. I'm not going to put my children on an airplane and run that risk. I mean, is that unreasonably nervous, or am I just more concerned about this than I should be?
I think a lot of America shares your same sentiments. But again, this virus does not spread via the airborne route. So you have to come in close contact with bodily fluids. And I think that's the key there. If everyone can remember that this virus is not airborne, it's not spread like the common cold or the flu, then I think it'll put some ease and take some of that anxiety and apprehension away.
Doctor, my question is a follow-up to what Rick said. As we go through our everyday lives, when something like this happens, let's say with a school or whatever, then there's training that goes on at all the schools to prepare for something that could happen in an emergency situation. Is there, in this medical field, is there training going on with our local hospitals if indeed a patient in West Michigan, let's say, has this, so that they're ready for it?
There should be. The CDC has sent out protocols to every hospital and freestanding emergency room in the country. So I know several emergency rooms that I work at here in Dallas absolutely have protocols, and we've gone through training and updated the staff on protective gear and what has to be done in case a possible Ebola patient does arrive in the ER. So I would have to say the same thing is going on in Michigan.
Dr. James Pickney II with Diamond Luxury Medical. That's in Dallas, Texas this morning. Thanks for your time.
Oh, thanks for having me on the show.